So we were just discussing sex drive and just discussing about the fact that there is a thought that you do lose your sex drive, and the reason behind that might be lots of different reasons. Now, you mentioned about actual, like, it might be the chemicals that you're having. Now, are there particular chemicals that cause these things, or is it?
I think just in general, all chemotherapy and all radiotherapy it's all documented that there's a huge increase in fatigue. That's just one of the side effects of any cancer treatment.
Yeah.
And I think, you know, when people are suffering fatigue, I think they don't actually understand quite how debilitating that is. It's seen as, you know, when we use the term quite flippantly, oh, I'm so fatigued, you know, I'm a bit tired, is really what we mean. Actually, when you think about fatigue in the context of cancer and cancer treatment, it's debilitating.
Yeah.
And that's very normal. It's one of the most common side effects and long-lasting side effects from any cancer treatment.
Yes, yeah. And Jemima was mentioning to me earlier about morphine, and in particular, now I'm going to get this wrong, and you're going to make me look like an idiot. Metoclopramide, which is a sickness drug.
It is, anti-sickness drug.
Yes, and in particular, I believe what she was talking to me earlier is that they're ones which really do affect your sex drive with the fatigue, and they've been tested to have those. But it's a wide range of things, right?
Absolutely, yeah. And often a combination of things. It's very difficult to pinpoint it to one thing that causes it. It's just an accumulation. So people will be fatigued after one round of chemo, but the time they've had 3 or 4 or 5 or 6, that fatigue increases.
I think it's worth noting as well, though, that obviously we've talked about earlier that it does really depend on the person. As I'm going to use my own experience, was that I didn't actually lose my sex drive in a way. I expect it wasn't a thing like we mentioned. It's not a priority, but I remember thinking that I should, in a way, have lost my sex drive, and I think my girlfriend thinking you're going to lose your sex drive and things. But it is a completely dependent thing. I think.
Yeah, absolutely. It depends on the treatment that you're having. It depends on who you were and what you were before.
Yes.
So not everybody is affected. To or people may be affected to some extent.
Yes.
But yeah, I think that's maybe more unusual. But it happens.
Yes, yeah. And if we're talking about when people might have a low sex drive, are there any tips? Are there any things that we can offer up as things that might help?
I think it's just practical things, you know, realising that fatigue is very common, that all of the other side effects, say some nausea, all the unpleasant things that perhaps come with treatment. And making time, you know, you make time for eating, so maybe almost take it as one of making time for sex.
Yes.
Not particularly a priority, you might not want to do that, but it's, you know, I always say to people when you're trying to eat, make sure that your environment's right, that you're comfortable, and I think you can apply all of those tips to sex as well, that it doesn't have to be nighttime. It doesn't have to be what it always was before.
Yeah.
You can say, well, actually my energy levels are higher in the day, in the morning, first thing in the morning, so why can't we think about having sex in the morning rather than at night time or when the kids are out? So all the things that might be causing anxiety or stress and making it more difficult, try to remove those other anxieties so that actually you do have time and you are comfortable and you are settled and you are relaxed. And then, you know, that can help.
Because there's a lot about the conversation, right, as well, and it's about if you're wanting to Netflix and chill, doesn't just have to be at night.
Yes,
right? It can be
exactly. The same applies.
And it's about being open, having those discussions.
Yeah, and I think you're absolutely right. I think it's about being open and honest and being prepared to talk about it and saying, do you know what, not now, that doesn't work for me, but this works for me, or can we think about doing this? And I do think that sometimes when people are going through these therapies, that relationship dynamics change, and that can be a problem, but sometimes just acknowledging it and talking about it can help. So, you know, if you're a partner of somebody who's going through treatment, I think you certainly some of the time perhaps stop seeing each other as partners.
Yes.
And start seeing each other as, you know, brother and sister or parent and child. The relationship shifts because there are different expectations on each other, and sometimes, you know, that's not maybe going to help in terms of sex. And it's being aware of that, recognising it and talking about it and trying to get back to even if it's not all day or every day, it's just having moment together when you can keep that relationship as it is.
It's that transition of like being a carer but also being a partner, a girlfriend, a boyfriend, and how you can balance the two of them at the same time, because obviously you want to look after that person, and I guess there's the difficult thing of like looking after them can be in a sexual way as well. Should we talk about actually during treatments and things, and the impacts of specific treatments? We're probably not going to be able to cover all of the different treatments, but should we look at so chemotherapy? Obviously there are so many different types of chemo, and to ask us to put to go, yes, this is what happens, but chemo itself, what effect can that have? I mean, we've mentioned fatigue. Are there other things that it can do to your sexual drive, and also when you...
I mean, if you think about chemotherapy, it's essentially a toxin, it's a poison that you're putting into your body, so it's not surprising that there are many, many, many side effects.
Yes.
Yes, it can have a direct effect on sex drive. As we've already said many times, fatigue is a huge problem, loss of appetite, hair loss, weight loss, so many things. And if you think about how an individual feels with any one of those symptoms, physical symptoms, and how would they then see themselves changing as an individual when they look in the mirror, they look like a different person.
Yes,
And that has a massive impact. Very often people want to feel comfortable and feel good about themselves. It's putting on something nice to wear, it's putting on a bit of makeup, it's doing the hair, all of the things that people like doing. And if that's removed from you, it has a real negative impact on how you feel about yourself. And I think therefore a knock-on effect, or the assumption is, well, if I don't like what I see or how I feel, why would anybody else?
Yeah. Yes. Well, and I guess again that comes down to you being able to be open to the fact that change has happened and talking to your partner about it. I remember because I lost weight, but I also put on a lot of weight because I had ESHAP, and so I was being pumped with water and to dilute the stuff. And I remember I was really I podged out, I had little fat cheeks and things, and put on weight here and there and everywhere. And I remember looking in the mirror and being like, I don't recognise this person. And also, that person is not a sexy person right now. But also then, I still, as a young man, had desires and needs. I had a very attractive girlfriend. So I remember that balancing act is also being aware that your partner might not find you sexually attractive. As well.
Yeah, and I think there's also an element of fear from partners of, even if they want to have sex, they shouldn't be putting that kind of expectation of that burden on somebody else, because gosh, haven't they not got enough to think about with just getting through treatment, without having to feel that they've got to perform. And on that side of things as well, that's really shouldn't be something that you should focus on. That takes a real back seat, because it's more important that they're eating, that they're getting through the chemotherapy, that they're not being sick, that they're getting to appointments. All of those things take priority, and people don't want to then overburden partners. I think that's very reasonable.
And that's it's an interesting dynamic when perhaps you're the one who is like the person who's having the treatment wants to have sex, but the other person is seeing them in a fragile state and thinking, well, what can we do? But also, the caring aspect comes through of going, well, if it's what they want, then maybe this is the way. And that's...
I mean, I think, I never like to give advice, but I think I would always try to tell people to talk about things, because usually talking about things helps. And even if it doesn't resolve it, at least it gets it out there, and you can get your point of view across. You can say, look, this is how I feel. I'm finding this really difficult. And now okay, maybe it's now difficult for us to talk about it, but ignoring it and pretending everything's okay doesn't usually help. So tend to say to people, talk about things, even if it's difficult. And for some people that's easy. It's like, oh yeah, I hadn't really thought of saying that. Maybe I can just be honest. For some people, they've been in relationships for a short period of time, but they've never had to talk about anything particularly. Or they've been in relationships for a very long number of years, when actually they'd stopped talking about anything, and they've never had those conversations, and it's difficult. But sometimes I think just recognising if this is how I'm feeling, the other person's probably picking up on it anyway,
Yeah.
and they're not comfortable. So we're both thinking something, so let's just put it out there and talk about it.
Yes, yeah. That takes bravery, right? That's
For sure.
Yeah.
Particularly when you're in a very fragile state.
Yes.
Either as a patient who's feeling in a very fragile state, or as a partner who is aware that that individual is fragile and doesn't want to overburden them with some other concern of, oh, by the way, I don't think you're very attractive at the moment.
Yes, yeah.
Huge.
We've discussed chemo, and what about radiotherapy and things? And does that have an impact? Obviously, aside of things that we've already mentioned, are there extra things that happen with radio?
I can't talk generally about radiotherapy because in my role I look after patients with acute leukemias. So when I talk about radiotherapy, I'm talking about total body radiation, which is separate to everything else and has lots of complications. I guess what you're asking is radiotherapy in the context of localised radiotherapy for maybe gynae cancers or prostate cancer, something like that. Is that?
Yeah, I guess so, yeah.
Now, often that's given in conjunction with chemotherapy, or it's given after chemotherapy, and of course you've already got the side effects of chemotherapy and then you're compounding it with radiotherapy. But if it's just radiotherapy, so it might be occasionally, and it's very localised radiotherapy, then you're targeting one area, one small area, countless times with radiotherapy, which causes localised damage. Now, if you're thinking about a gynae cancer, then, for example, women who have got gynecological problems are going to get very, very sore around the vulva, cervix, and so anything that's directly hitting an area is going to be possibly causing pain, discomfort, dryness, and all of those things make it very, very difficult to have sex, not just kind of emotionally, but physically difficult to have sex.
And are there things that we can recommend if people are experiencing things like that with dryness and things?
Absolutely, and I would say, as we've said at the beginning, that if you experience any side effects, then the person to talk to essentially is your clinical nurse specialist. I'm not an expert in gynae cancers or urology cancers, so that's really not my area. But for sure, your nurse specialist will work with, that's what they do. So they will be able to recommend products for, say, vaginal dryness or discomfort. Really talk to somebody because there is help out there. So don't keep it to yourself and think, well, it's just one of the side effects of treatment, so I'm not going to ask, I'm not going to complain. People don't want to be seen as complaining. It seems it's not really a priority. There's everybody's here is trying to save my life. It seems a little bit petty to say it's a bit uncomfortable when we're having sex, because actually there's so many other things that should take priority. I don't want to dwell on that. I don't want to make a nuisance about that. Please, you should tap into the help that's there, and there is help out there. So never ever be frightened to say, "Can you help me?"
Yes, I think there's a big guilt thing there, right? When you're going through things that, I need to focus on the fact so many people are around me trying to help me, and that you feel, well, maybe I should just be focusing on that. But some people can be in treatment for years and years and years, their whole lives and things, and sex is part of living.
Absolutely,
right?
absolutely. And actually, if you're not sharing, if you're not asking, it stays with you, and you're just overplaying it in your own mind, and you're becoming more anxious, and it manifests itself in other ways. So take a deep breath and ask somebody.
Yes.